We have seen it done, but
You
we
guys have
didn't
seen it.
perform.
All right, good. So, otoscopic examination in family medicine is something unique in a way that you should know how to perform it, and what are the indications in terms of primary healthcare when the patients are coming to you, and you want to use the otoscopes. Then you must have this basic skills in order to make a better diagnosis, because all of the criterias are not for the referrals, so you should know how to use it, and how you can manage it. So we'll see what are the indications for that. Okay, we'll learn how to perform otoscopy. The conditions that we are performing otoscopic examinations in primary healthcare is usually because of ear pains. Ear pains could be because of otitis media, otitis externa, and how are you going to differentiate between these two? Symptoms will have the ear pain or ear discharge. For these conditions, you are going to perform otoscopic examination. We'll have a look of the video also later on. So first of all, while you're performing the ear examination, you first need to introduce yourself. So introducing yourself and ask for pain and the better hearing ear. So first you need to introduce yourself, ask where is the pain if there is pain present, and which is your better ear. Then number second thing is you ask the patient to smile, because when you ask the patient to smile, you are actually checking for the facial nerve problems. And then as we go on all of the conditions, you first need to do some inspection of the ears regarding the deformity, regarding the skin condition, regarding the pre and post auricular areas and things like that. So when you're done with your inspection, you will do for palpation, but first you need to check in the palpation for the mastoid tenderness. Mastoid tenderness is important because it's the contraindication to perform ear examination. So you need to be very careful about that. First, you do that, and then you later on proceed with the otoscopic examination. While when you're doing otoscopic examination, you need to observe from the external auditory canal and then the peripheral areas, and then you're going right away into the tympanic membrane and have a comment on the tympanic membrane also. So how to perform otoscopic ear examination? You try to use large ear speculum, yani as large as can be, yani that can be fitted in the ears. If the ear is good, then you should use the largest one that you could use it as an ear speculum. You the of the otoscopic examination, how you're going to hold the otoscope? Just hold it like a pen, and then position of the pinna. Pull the pinna in adults upward, outward, and backward. Upward, outward, and backward. In children's, you do a little downward and backward because their canal is more horizontal. And that's the reason the children are more prone to have otitis media or external, because of the lack of inclination in the external auditory canal. So inspection, you are going to inspect for the external auditory canal. You see if there are any wax or not, and then if you go right inside, you're going to see what is the tympanic membrane and how does it look like. Is it intact, not intact? What are the normal landmarks? So we'll see here normal tympanic membrane landmarks. We have, you see, it's a very good shiny tympanic membrane, and it has got incus here. This is the eardrum that you can see. It is the light reflex. So cone of light is very important. And then there is malleus. So malleus, incus, and eardrums with a light reflex. This is going to make a normal tympanic membrane. If you see one of your colleagues' tympanic membrane must be normal in this way. Now you see here, this is a pathological problem. Here you see there is no redness, no inflammation. Here you see there is inflammation. There is also bulging here. There is some pus accumulating here. Light reflex is gone. So all the all the landmarks that are there, that were there, they all are gone up because of the swelling of the tympanic membrane. So this is most probably because of the otitis media or inflamed tympanic membrane. Now what you see here it's a perforation. So now it is perforated, uh, and we have safe perforation and we have unsafe perforations. um, but we are concerned about perforation. By the way, every perforation is not a referral criteria, because perforations do heal on its own. So you are not going to refer every patient, but you're going to refer the patients who are not responding, or who still have perforation after maybe 4 weeks or 6 weeks. And it's if the perforations are in the unsafe area, you're going to refer this child or a person. So now the question arises: you do an otoscopic examination. Before you're going to the otoscopic examination, how are you going to differentiate between otitis media and otitis externa? Because this is something which is very common in primary health care. So you need to make sure that what you are dealing with. So in otitis media, the pain followed by discharge is media. So if you ask in the history, is this the pain comes first or the discharge? So we are talking about those patients who have ear pain and then they have discharge. Now, once they have the discharge, you don't you would not be able to clearly identify that what was the problem, because whether the so why it is important. The important thing is, in perforated otitis media you have discharge and pain. In otitis externa you also have discharge and pain. So in the basis of symptomatology, they are the same. They have pain and discharge. But actually, one is otitis perforated otitis media and the other is actually otitis externa. So how are you going to differentiate? Because you can't do otoscopic examination. Because if you would have done otoscopic examination, you would realize that, okay, tympanic membrane is perforated, and that's the reason we call it as perforated otitis media rather than otitis externa, because after the tympanic membrane, what happens is otitis externa. All right. So but here clinically, you're not in a position to differentiate between whether it was otitis perforated otitis media or otitis externa. So you would like to have a detailed history, which is all right. So there is a pain, and then you ask the patient, the pain is followed by discharge. This is otitis media. So if the patient says, no, doctor, the pain and discharge come at the same time, so this is now you're dealing with otitis externa. So this is how you're going to differentiate. Now, the second thing is contraindication. So if there is a mastoid tenderness, it's a clear-cut contraindication. You don't do otoscopic examination. You need to refer the patient out for the ENT consultation and do some measures about it, because mastoiditis is a referral criteria in primary health care. So in children's, it's very important to have otitis media. So recurrent otitis medias are also very important. So you need to address those risk factors attached to it, because unless you don't address the risk factors, the child keeps on presenting to you with this recurrent otitis media. Just a minute. I have a okay. You guys can hear me, right? Okay, so risk stratification, you do bottle or breastfeeding, making it upright, and parental smoking and swimming. So these are the risk factors that you would like to that you would like to address on, because the child is on recurrent ear infections? Now, when to refer? Unilateral unexplained pain in the body or neck area for 4 weeks. So anything which is unilateral and it is persisting for 4 weeks in spite of the treatment, you need to refer the patient, and if the patient has mastoiditis. All right. Okay, so that's the brief presentation on otitis media.